So for our case, our patient is a 76-year-old with increasing low back pain and has a bilateral posterior and loss LOM, weakness, pain on his both LE. Patient also has a controlled hypertension since 2019 prior to his coronary artery bypass grafting, and patient also present a loss of vibration sense on his toes and absence of ankle reflex. So I will approach my patient by greeting him and building rapport to gain his trust. So let's start. By the way, this is my hypothetical patient. So, hi, good day, sir. I'm Patrice, your PT for the day. How would you like me to address you? Okay, Sir Andy, so before anything else, I would like to inform you that we will be having a skin-to-skin contact. If it's okay to you, let's start with our vital signs. So, assuming that patient's vital signs are already checked and it is within normal limits, so we can now proceed to our assessment. So, for our precautions, let's take note that the patient has a hypertension and has a coronary artery bypass grafting, and patient also has a decreased vibration sense on his toes and absence ankle reflex. So for our assessment, we will be doing treadmill test. So treadmill test is the patient should in standing position on a treadmill. So sir, we will be doing our treadmill test. So for the procedure, you should stand on a treadmill and walk for 10 minutes. First on level plane, then next is in inclined treadmill for about 15 degrees. I will be giving you 10 minutes rest between both trials. Okay, sir? So, okay, sir, let's start. So, patient is assuming that patient has a treadmill and doing the exercise. So, after 10 minutes of first trial on a leveled plane of the treadmill, ask the patient to rest. Okay, sir, rest po muna tayo. And next is we will be doing the inclined treadmill about 15 degrees. Okay, so next, after 15 minutes of trial in inclined treadmill, ask the patient to rest. Okay, sir, let's have a rest and before we proceed to our treatment. Okay, for the treadmill test, for the positive side, it is onset symptoms with leveled walking with prolonged recovery time after the 10 minutes of early walking or increased walking time in inclined treadmill. So, for the indication of the treadmill test, it is neurogenic intermittent claudication of lumbar stenosis. So, next for treatment, so I will be giving the patient tense on his low back and also in low back and his both lower extremity. We can use FES while doing the treadmill or the treadmill test. So okay, so for the aftercare, check for the patient after the assessment and treatment. So, sir, do you have how do you feeling? How are you feeling, sir? Are you okay? Are you tired? Okay, so do you have any question before we end this PT session? Okay, if none, let's check for your vital signs. Okay, assuming that patient's vital signs are within normal limits, so we can now proceed to our, so we can now end this session. Thank you, sir, and have a good day.